Hello and welcome to the Practice Marketing Podcast, highlighting successful strategies from North America's fastest growing clinics and experts so you can learn from their wins and power your practice growth. Hi, I'm your host, Neil Trickett, CEO of Practice Promotions, and today we're talking about Beyond Treatment, how diagnostics can transform a PT business with Eric Bull from Integrity Diagnostics. And Dr. Eric Bull is the co-owner of Integrity Diagnostics and a physical therapist with a passion for helping clinicians get to the root cause of their patient problems. And Eric really is a true genius in business and has built multiple successful businesses over the years. So I'm really excited to interview him today and share how he's grown his businesses, especially in this really innovative and cool diagnostic space. I'm thinking to get some really great ideas and excitement out of that. And he's also going to share how diagnostics can transform a PT business for the future. And Eric is also a truly great friend of mine. We've known each other for 20 plus years. He's an amazing individual. So Eric, welcome to the podcast.
Oh, thanks, buddy. It's always good to see you and good catching up. So excited to do this. Thanks for the invite.
Yeah, thanks so much for being on here and sharing your wisdom with our audience. So just to tell us a little bit about your story, as a PT, your practice, kind of how you've, grown these different businesses over the years.
Well, when I was 10 years old, my dad said if I wanted to have a car when I turned 16, that I needed to get out and get a job. So he said he'd pay for the gas and the lawnmower. So I started mowing grass when I was 10 years old and saved up for a car that I bought when I was 16. Just kind of from a young age, I always just, wanted to be productive and kind of had that entrepreneurial spirit from the very beginning. My dad was a business owner, owned a chemical manufacturing company. So just kind of in the blood sort of thing. And then after PT school, graduated in 97. Don't tell anybody. That was a long
98.
time ago.
Okay,
And my very first job, January of 98, I was actually a clinic director of a small rural clinic in Missouri. And then within 16 months, I had my first physical therapy outpatient practice and out in Arizona, where my wife was going to grad school. And then I sold that and went to do a fellowship in Australia. When I came back from that in 2002, I had 32 job offers in the U.S. Haven't been one of those, kind of first, right around 100 people to have done that advanced training in Australia. So when I came back, my college roommate, who you know well, also Jacques, he was in Savannah, Georgia. So we moved to Savannah. And then he was, we thought Savannah was going to be a cool place, which it absolutely has been. My wife and I thought we'd be here for a year, and that was 23 years ago. You know how life is like that. Jacques and I started a practice then together about 16 months after making it to Savannah, grew that to about 24 PTs, 100 employees, 2 states, and then I sold that in 2017 to one of those VC-backed companies, and then March 20th of 2020 happened. COVID, got furloughed, kind of from a middle management position with that company. And, just like many of us who are kind of sitting at home, not knowing what the future was going to hold, almost to the date, 4 weeks later on a Wednesday, I cracked a beer and sat on the couch at noon. And I looked at the beer and I went, okay, this is not good. And so I literally put it down, got up, went to my computer, and I started to look at, whether any med, at this point I'm in my mid 40s. So, med schools, any distance-based chiropractic schools, I had a non-compete. So, I knew that I just needed to be doing something else. I couldn't go back into insurance-based, outpatient physical therapy where I was specialized before. We had actually contracted with my current business partners in Integrity Diagnostics to provide the services, to provide electrodiagnostic services, to our practice back in 2015. I was aware of, EMGs from that moment in time back in 2015. So I just literally within a couple hours kind of doing all this research, picked up the phone, and I called my current business partner, Rick McKibben, who's has the only ECS preparatory course in the United States and has been teaching for 25 years electrodiagnostics, EMG. And he's like, well, as coincidence would have it, in 2 weeks, we have our next training cohort. Would you like to come up and see if it's something you're interested in? So by May 1st of 2020, I was up and started to train doing EMGs, and partnered with that practice about a year later, and just kind of never looked back. We started growing Integrity Diagnostics, which is now we're in 8 states. We created a network of electromyography providers that are across the United States. I think we're at 46 locations in 8 states. And then, we have many locations in Georgia because we're based out of Georgia.
Mm-hmm. Congratulations on all your success. You built really something truly amazing there. And so for our audience out there that's not quite familiar, they've heard of AMGs. It's something they maybe studied in a in a textbook back in PT school, right? But how is EMG and this kind of testing now used within, say, PT clinics, but also physicians' offices? Kind of like what you guys do on a day-to-day basis.
Well, I guess kind of two things on that is the a lot of PTs don't even know that we do EMGs. In fact, it was 1953 when the first physical therapist published in the Physical Therapy Journal about doing EMGs. And then in 1974 is when electromyography, or electrodiagnostics was first recognized as a chapter by the APTA. So 52 years ago. It's the second oldest board certification. The first board certified specialist in EMG was 1986. So it's just been around for a long time. The problem is that there's only been 269 board certified electrophysiologists ever. And there's, around 200, maybe 220 kind of currently still practicing, regularly doing EMG. So it's just such a small niche. So it's hard to, kind of help all the, how many PTs are there right now? 300,000 maybe, something like that?
Somewhere
More?
like, yeah.
Yeah, so if there's like 220, active people doing this one thing, it's while it is on the the national board exam, there's only I think 3 or 4 questions about it, so it's just not something that's kind of covered. So that that's one of the reasons that it's kind of hasn't gotten a huge foothold, is there's just so few of us kind of doing it on a regular basis, and there's some reasons for that. But then you had to ask kind of almost a two-part question. What was the other part of that
You
question?
just kind of how like that day to day then works
Mm-hmm.
for Integrity Diagnostics. Is it something you run from physicians' offices? Do you have your own certain locations? Kind of curious how you run that.
Yeah, so there's in almost all instances, there's kind of two general models. One is providing the service kind of contract style in-house. So, for example, but we hold contracts with orthopedic surgeon offices, neurosurgeons, hospitals, and so they need the service. And so, kind of like how an orthopedic surgeon has an MRI in-house. Well, they contract with a radiology group to do the read of the MRI and interpret it. So the MRI is physically being conducted on site. It kind of owned by an imaging center or the physician group, and then the radiologist is contracted to do the read, and right, and they're paid, probably a flat fee or something, something like that to do the read. Well, in a similar nature, because the EMG study is physically performed, you're doing the physical examination, like you're putting the probes in and doing the stimulation, but then you're also doing the intellectual and academic interpretation of the data that you just collected. And so you contract with them because there's a bolus of patients that are just able to, have the service provided. So you just then typically, negotiate a rate, and you provide the service as if it's in-house being performed and on the orthopedic surgeon practice's letterhead. And then the other is the much more common way where you have insurances, you market and advertise, and you receive the referrals in-house, and you do them in your clinic. And so we do a lot of both.
Very cool. Very
Yeah.
cool. And so how long does a EMG usually take to perform, and then also the reporting?
Yeah. Uh, Depends on how long you've been practicing. Well, if you did, yeah, it's just like,
You gotta have somebody.
yeah, exactly. That's no. A test normally books. Once you're board certified, it takes several years and hundreds of studies, if not thousands of studies, to kind of become competent. The majority of individuals that do an EMG kind of on a daily basis book an appointment for an hour. And in that hour, you should be able to, do your clarifying, your physical examination, which is, a musculoskeletal, quick exam, to see kind of what the problem is. You're looking at the physician's referral, trying to, and you're speaking with the patient, doing tapping tendons and doing any sort of orthopedic special tests, any neurological special tests that would be necessary in order to kind of form a hypothesis, because the electrodiagnostic study, right, the EMG and the nerve conduction study, it's an extension of your physical examination.
Mm-hmm.
So you do a physical exam, and then you're clarifying, the outcomes of that examination with the electrodiagnostic study. Man, I started to talk right there. I got totally. Did I answer your question?
You did, yeah. So roughly about an hour of time with the patient in
Yeah.
there. And then how much time reporting wise does that take to put together?
Yes. A report. So I still hand type. Some guys will dictate it, but the report actually goes fairly quickly once you get 1,000 reps under your belt.
Mm-hmm.
It'll take 15 minutes.
Oh wow! Okay,
Yeah.
that's
So
I thought it was something that would take a while. But that's
so if I have patients, booked from kind of 8 to 4, no lunch, 8 patients right in a row, my expectation is that I'll be walking out of the clinic by 4:15 with all notes done and submitted, and I'm going home free and clear without any additional paperwork stacked up. And that that's definitely something different. Is in the outpatient environment, you're sitting there doing notes on the weekend. We guarantee in our contracts that we'll provide service the report within 48 hours, but it's normally same day.
Yeah, that's really cool.
Yes.
And so obviously things fluctuate by state and insurance and stuff, but what's sort of a range of reimbursement for that kind of study?
Yeah. Any place kind of $330 to $380 might kind of be like an average reimbursement.
Mm-hmm. Excellent, great. And so for our audience out there, what is that difference in the between an EMG and an NCS? So the nerve conduction study, right?
Yeah. So there, in general, we hear the term EMG, which stands for electromyography, but and that's what people come in and saying, I'm here to get an EMG. And what they're really saying is, I'm here to get an EMG and nerve conduction study, commonly referred to as an EMG. First part is the nerve conduction study. The nerve conduction study is essentially, placing small electrodes on the, arms or feet and stimulating the nerves in order to see, how fast and healthy they are.
Mm-hmm.
In the most common condition that we see is carpal tunnel, right? So a compression of the median nerve as it goes across the wrist. And so, as we examine that by comparing the radial nerve, the ulnar nerve, and the median nerve, both the sensory and the motor components of each of those nerves. And so you'll see kind of the most common things would be like it gives a severity rating of the carpal tunnel. So, for example, if what they have compared the severity scale to clinical treatment. So, in general, if it's a grade, so there's a 5-point grading scale. Well, 6, 0, right? 0 is normal, and then 1, 2, 3, 4, 5. So if you imagine something goes like the median nerve goes from 0% compressed to 100% compressed, and you have a 5-point grading scale. This isn't exactly how it works at all, but it's just kind of like, it's like McKenzie. It's kind of like a way just to think about it, is that, like, so a grade 1 would be like the first 20% of compression, grade 2, 20 to 40% compressed, like that. And so you go through 1, 2, 3, 4, 5. A grade 1's very mild, 2's mild, 3 moderate, 4 severe, 5 very severe, sort of thing. And what they have shown is that if you have a very mild carpal tunnel, you're typically going to respond to conservative care, physical therapy, injections, nighttime splinting. If it's a mild, it's like 50-50, right? So like some of those patients are going to respond to conservative care, and some will fail conservative care. So as a clinician, it's going to give you an idea about, if I examine the patient and they're severe, the likelihood that physical therapy intervention is going to fix that problem, it's just not statistically likely. So it allows, the clinician who's examining them, if how those correlates work, you can actually make really good treatment decisions about how to treat that patient. So that's going back to the beginning, the nerve conduction study is essentially looking at the health and the speed of the nerves. And then the second component of the examination is the electromyography. And that you take a very tiny pin. It's like a 26 to 30 gauge. So it's as small as a diabetic pin or an acupuncture or a dry needling needle. And you're inserting that. It's essentially just a fine wire that's coated in Teflon so that it glides easily through the skin. I mean, the reality is most patients don't even have even one drop of blood through the insertion and the retraction of the pin. It can kind of just feel like getting pinched a little bit. It generally doesn't feel like getting a shot. The hands and the feet are a little bit more uncomfortable because the hands are simply more densely packed with pain nerve fibers, right? So that if you touch something hot, you can retract and pull away and don't harm yourself. But, the forearms and arms are really, sometimes people will say, "Can you even start?" And be like, "Yeah, I'm already going." Kind of like that. So it's, there's a lot of misconception on the internet about how uncomfortable it is. I mean, yeah, when you have to stick the hand at, which we do all the time, it can be a little uncomfortable, but I say, this feels like a sweat bee sting. And I think, oh, okay, all right, that's fine. And we're done, sort of thing. So it's not really that bad. In the EMG component, you're actually listening to the electrical activity of the muscles. And so, if you just kind of think that, when nerves are transmitting electrical signals, like if I say lift my arm, right, my brain, right, is going down, sending electrical signal, right? Brain, spinal cord, out the nerve root, down the nerve, all the way down to the axillary nerve to lift my shoulder like that, right? Well, if you kind of get a pinched nerve in your neck, right, kind of like downstream from wherever you have a pinched nerve, kind of like kinking a hose. If you kink a hose, that you can see and hear problems downstream. And because the muscle and the skeletal system is only working because of that electrical impulse flowing, if there's been changes to the function of the nerve, you can kind of see and hear it in the muscle. Kind of like a hose watering a garden. If you go to the garden and it doesn't look as healthy, you kind of know that something kind of might be going on with the structure itself.
Yeah, it's very cool. I mean, I've been and I've seen that done in training, and I was like, oh wow, these guys are like so smart here. The things that they're doing here. But it's like you said, it's such a niche, and I love how you dove into this niche. And I'm really curious how you took, obviously something started out, right, and with Integrity Diagnostics, and then how did you grow it so quickly?
Top 10% of PT owners aren't just surviving, they're thriving. But what's their secret? Well, Neil Trickett's new Market to Grow book reveals how the top 10% of PT practices leverage marketing systems to simultaneously grow their new patients, attract top talent, and boost profit in their practice. You can learn from their secrets. Visit practicepromotions.net/book to claim your free copy of Market to Grow. Yes, you heard that right. We are shipping a free copy of Market to Grow to all podcast listeners who want it. Just visit practicepromotions.net/book to claim your free book. And now back to the show.
Purpose. Yeah. Neil, that's like a real purpose-oriented question. It's, when I partnered with Integrity Diagnostics, they were doing an awesome job already. So there was a great base to grow from. And so I just, I have a history of growing things, and I like people to be successful, and I like to bring people along on the journey and create jobs and create opportunities. I just kind of have a long history of doing that. A growing business is way more fun to be a part of than a dying one. And so, the need for this service, it continues to grow just exponentially. The national wait to get an EMG is 4 months.
Gosh. Wow.
Yeah, and so we in our practice run, including weekends, 17 days. So it's just a significant difference in how long somebody has to wait with us to get that examination.
Mm-hmm.
And there's no shortage of people that need this examination. As the baby boom generation generation continues to age, the pinched nerves and the stenosis and the radiculopathies and the generalized polyneuropathies. These are all the sorts of things that, we diagnose with electrodiagnostics. So there's just no shortage of people that need the help from the services that we provide. And because there's so few of us, it's just, there's a lot of opportunity.
So that's curious because there's a huge demand, right? And I love that you have this great opportunity. Obviously, it takes time and skill development in order to become board certified and do this. So I'm kind of curious, how has been your approach to working with different ECS, right? Is the term I think you use, right?
Yeah.
ECS, right? And then also like development of people within your team who want to do this, but then go through that. So like, how have you approached that?
Yeah. The individuals, there's almost like two groups when I kind of think about all the individuals that I know. There's the people that like just from the very beginning had heard about it and were interested right from the get-go and kind of, got trained, kind of in the first couple of years, right? And then they've been practicing for a long time. And then there seems to be like this other group of something happened, COVID, some other kind of like life event where they just said, hey, I want to go like do this thing, because the investment in time that it takes to complete this board certification is quite significant. To become competent, it's it's a minimum of 500 studies, which that's like just a number that I'm saying. That's the same number you have to have if you're going to, take the challenge of ECS examination, having not gone through a residency program. It's 300 if you go through a residency program. But it's really more on the order of 1,000, 1,500, working up to 5,000 studies that it takes to like truly, become, quite competent at the performance of the examination. And so it just takes it's not a 3, 6, 9 month sort of thing. Like it's a grind, and it's very important that the training is one-on-one and with a highly skilled mentor, because the technical side and the academic rigor to get all the information takes a while. Then there's the intellectual interpretation of the data itself. And then there's the technique of gathering the information of high quality to be able to go under interpretation to form the impression. So all of that just, it like takes 2 years at minimum, maybe 3.
Mm-hmm.
So that's one of the barriers, kind of was saying before, like, why has there only been 269? And the answer is that, you learn the exact same skill set to perform the EDX study as a physiatrist, neurologist, or neurologist to perform the study.
Mm-hmm.
So you're learning the exact same material, the exact same neurophysiology, anatomy, I can draw the brachial plexus. It's like you learn it in school and then you kind of forget it. But, as an electrodiagnostician, it is part of who you are.
Right.
So, we're tapping on tendons and checking muscles and, doing all that all the time.
Mm-hmm. It's so cool. And I want to go back to 2015 because you mentioned that you actually had people come in and do this in your
Hmm.
PT clinic when you had, was Spine and Sport was the name of the?
Yeah. Spine and
Yeah.
sport. Yeah.
You had Spine and Sport, right? And so that's really thinking outside the box. And that's one of my, kind of purposes for this year in the podcast is really to enlighten other practices in looking outside of the norm, right? Outside of the box, because in order for us to
Hmm.
transform as a profession, we cannot just do what we were doing forever with insurance-based care, right? We have to think outside the box more, and we have talked to hands-on diagnostics and different groups and different individuals that do run EMG studies within their clinics. So I'm curious, 11 years ago, what were you thinking when you were saying, hey, maybe we should bring in EMG studies to our PT clinic?
Hmm. Always looking for the next opportunity. We knew that so we had one of our clinics was very close to a very large military base. So we knew that they didn't have anybody on site doing that work. And we had heard that, by treating the active duty soldiers, we knew that some of them had that order and were waiting for lengthy periods of time in order to get that done. So here you have a soldier who's literally their body is their product, right? I mean, they are physically active and doing PT every day. They were in the infantry, or the group of the individuals we were working with. They, we just knew that it was really a long time. And so at Rocky Mountain University, where I had gotten my doc sci in orthopedics, I knew that they had a program. So I kind of reached out and actually, got a hold of Rick McKibben, and we just started talking, and they were, we were contracted with them to provide that service. So
That's
yeah,
really cool.
yeah. I mean,
I think, kind of coming back to your entrepreneurial spirit, and I know it was Jacques too, your partner at that time, um, looking for the opportunity. And I think that's for a lot of PT business owners is where can you find the opportunities and networks out there, or kind of build those networks if you don't have them, because you saw that there was a need there, and like, okay, who can I contact that we can maybe bring this in-house? We don't have to necessarily deliver the care ourselves or kind of figure out how to train on this particular thing, but we could connect with someone to come in. And I think there's quite a few opportunities for PTs that they don't necessarily have to train someone to do something within the clinic, but like your kind of instance, being able to bring someone in that is an ECS specialist that can deliver those kind of things. They come in, so many times a month into the clinic so that you could do those kind of studies. There's lots of opportunities like that.
yeah. I mean, I think diagnostic ultrasound is also. I mean, I really hope that, and it seems, from going to combined sections meeting, and that many more academic institutions every year are beginning to, have beginning basic real-time ultrasound training. And I think that's a really great tool for physical therapy clinics to adopt as rapidly as possible.
Mm-hmm.
It's very helpful, just on the human side. It's, hey, you have an ultrasound machine, like, hey, there's your torn rotator cuff. Okay, I got a positive drop arm test, or like whatever, empty can. But then to put it on there and physically see it,
Mm-hmm.
I think is just very helpful, just as somebody who's going to be receiving care. It's like, oh, well, there's my problem. I can clearly
Yeah.
see that it's there.
Gosh, how many times have we heard that in the clinic where someone's like, well, yeah, but I really want to get an MRI also just to make sure, right?
Yeah.
It's
Totally
like,
happens.
I got all this big picture here of like, this is what's probably going on, and we can just go ahead and treat it. Or like, no, I really like, to get an MRI too. It's like, okay, well, guess what the MRI said? Yeah, exactly, right. But
Absolutely.
Yeah, you're right. I think that is a great stepping stone to a lot of these kind of higher level technologies and services that PTs can deliver. I think the diagnostic ultrasound is a tremendous tool if trained well on, right, and used within the clinic. And I think it's EMG is a very high bar to achieve. I think the diagnostic ultrasound is a great stepping stone in that direction.
100%, absolutely. Yeah, I think that this, in orthopedics, I did that for 20 years. And yeah, I just, my dissertation back in 2006, I actually used real-time ultrasound to measure the cross-sectional area of the lumbar multifidus when that was all going on, kind of back in the very late 90s, early 2000s sort of thing.
Mhm.
So that was what my dissertation was on. And I look back and I go, man, I wish I would have like been able to continue, but it was so novel at that time. I just, it could have actually been even more of a career changer. Um, it just, I missed that opportunity back then. But I do, we do a little bit of neural ultrasound now. We're not, RMSK, our group isn't, but you can actually use real-time ultrasound and take a look at the health of the nerves as well, which
Mhm.
is kind of an interesting thing.
That
So,
is a cool thing.
yeah.
And so, in what's your particular role within Integrity Diagnostics? Obviously, co-owner, but is there a specific area that you focus on? Like, are you the business development kind of person, or what's your roles there?
Everything. No.
Man of many
So,
hats.
yeah, as of a couple months ago, I'm the CEO.
Awesome.
So previously I was the vice president of administration, but business development as well. And we about a year and a half ago did hire an executive, our director of EMG services, and so he's got a master's degree in technical education, and so he just helps to go out and do marketing and, grip and grin, as they say, and help to grow the business. But with his background in, more in technology, he's able to help, on all those things that are going on in the business workaday world sort of thing. Yeah.
Love it. And we were just chatting. You're connecting with new opportunities, expansion. So I love the way that you're doing that there. So kind of curious for you, where do you see the future of Integrity Diagnostics going?
Yeah. Well, so we train individuals to become electrodiagnosticians to get their ECS. So, we have, many individuals who are training right now, employees. We have mentorship programs, for even individuals that are board certified. Our group and my business partner, and he has a business partner in another company that I was telling you, teach the annual electrodiagnostic board certification prep course. So we're heavily involved in educating and training individuals to be able to do this. So I see that has, we've been expanding that rapidly and well. And then, we're starting to, think outside the box as well, just inside our own discipline. As one of the interesting things that's been fun and challenging is because it takes 3 years to train somebody. Okay, well, once you get them trained, like, how do you, create an opportunity to where you're going to have them, move, open a practice, what specializations are there, inside of, because there's even specializations like upper extremity specialists, lower extremity specialists, pelvic floor sort of thing. So, what are some of the other opportunities that may exist for us to, move even and help more people and have a larger footprint sort of thing. So yeah, just expanding more states, more clinics, more helping more people.
I love that. And have you ever considered, or is it something that you do working with maybe with other clinics or other businesses to train therapists in becoming an ECS, or is it something that you
Yeah.
just keep within the business?
Yeah. So, our primary business model is, employees, but in our network, we have many individuals, I think 22 21 ECS, 22 ECS, and then, other individuals that are not board certified that, just want some mentorship and help getting trained. So we do that as well. Yeah.
Excellent. And so if there's, I think probably this is probably for like larger practices that are looking for other disciplines and different programs that they could put within their clinics. Is there a way for them to learn more about you and more about what you guys do? I'm sorry, you broke up a little bit there. Would you mind
I'm
repeating
sorry.
that?
Yeah. You can get to me through the website, integrity-dx.com. My email is integrity-dx.com.
Cool. Yeah. So integrity dash dx.com. We'll have that in the show notes too for everybody too. If you'd like to just see what they do and chat with Eric at all, I'm sure he's on LinkedIn too. You can reach out to him there, or his email
Absolutely.
that he just said there. So he's always great to have a conversation with, and incredibly wise person. Eric, thanks so much for being on the podcast with us here today and helping us understand just this really amazing, unique niche that you've developed. And congratulations on your success. I'm really
You
excited and
too.
proud of you for that.
It's always good to see you. Thanks for the invite.
Yeah, my pleasure. Thank you to our audience out there. I hope you got a lot out of today's podcast. Don't forget to like and subscribe to our podcast, as well as our YouTube channel where we have these videos and lots of other tips. And of course, at practicepromotions.net, we can get tons of marketing downloads and advice on how to move your clinic forward. So this is Neil Trickett from the Practice Marketing Podcast, wishing you much success in your practice.
A free way for you to support our show is by leaving a 5-star rating and review on Apple Podcasts. It's a chance for you to tell us what you love about the show, and it helps others discover it as well. Just scroll down to ratings and review on your phone and click write a review. Thanks.